Hi everyone. So Heart Disease Month, and yesterday we said that estrogen in a premenopausal woman has been shown to be protective against heart disease. Now, don't think of estrogen as just estrogen, because not all estrogens are the same. We have Premarin, which is a horse-derived estrogen. We have estradiol, which is natural to the body and made by pharmaceutical companies. We have 3 types of estrogens that are made within your body, and it's about how they balance each other. So today I'm just going to focus on estrogen, and because I have many men watching, I'll let you know that your testosterone becomes estrogen as we're eliminating testosterone from the body. So when you produce testosterone, you're actually also producing estrogen. However, testosterone is a different topic for cardio protection, which I'll talk about tomorrow. So you guys should stay tuned tomorrow. Anyway, back to estrogen. When I help women balance their hormones, I use bioidentical estrogen, and I use it in a ratio that's natural to the body. So we know that we have estrone, estradiol, and estriol, and some are safe. So estriol is the weakest estrogen. It's the safest. It's more important for the down there. So for your bladder tightening, for your vaginal moisture and mucous membranes, that's where estriol is most active. Estradiol is more brain and bone protection, and estrone is a potent estrogen that can metabolize down into some pretty dangerous metabolites. So genetics influences the metabolism of estrogen. Genetics influences your liver and the liver enzymes that metabolize estrogen and how we change it into safer forms. We always want to excrete out the bad forms of estrogen. Those are the negative metabolites that we are designed to get rid of. So bowel movements are very, very important for healthy estrogen balance. Why? Because you poop out the negative byproducts of estrogen for men and women both. Remember, I said men's testosterone becomes estrogen, and those negative metabolites are excreted through your gut. And so focusing on digestive health and just something as basic as pooping every day. And I'm surprised always at how few people have good, healthy bowel movements. So when we're looking at estrogen, we want to balance estrogen to healthy, youthful levels, but we also want to watch the metabolites to make sure that you're not accumulating the negative ones that would raise your risk for breast and prostate cancer. How do we do that? Well, the preferred time to start replacing estrogen in women is in the perimenopause range as it's dropping, or within a few years of the menopause. That's when the greatest clinical benefit is shown. That's not to say that we won't replace estrogen later. Now, this is contrary to what you're going to hear from your doctor, and I'm talking about bioidentical estrogen. Now, estradiol is bioidentical, so your estradot, your estrogel, but that's only one kind. I like to look at the balance between them and how your body can cope with them, and how I need to replace it based on who you are and the other hormones that affect your estrogen. So I think hormone replacement therapy is critical, even though your Heart and Stroke Foundation is telling you to beware of estrogens after, because it raises your risk for clotting. Well, why does it do that? It's because we're not looking at balance. We're not looking at all of your body functions. And in functional medicine, that's exactly what we do. We're looking at how everything interacts. We're looking at, do you have inflammation? Now, inflammation underlies all chronic disease. And we're going to help you with your diet, your lifestyle, and any other hormonal and other imbalances going on that increase inflammation. If you're inflamed, yes, you can make blood clots and heart disease. But in our world of functional medicine, we use hormone replacement therapy to prevent chronic disease, to make you healthier and younger. So I wanted to point out that in current science that's available, we're not showing that all estrogens are bad for you. Yes, the birth control pill. Do not take that if you're older than 35 as per the recommendations. I don't even recommend it for younger people because it's a synthetic estrogen, and there's a lot of data to show that the oral contraceptive pill not only increases your blood clotting profile, but it increases your risk for breast cancer, which doesn't matter to a 20-year-old, but it certainly matters when you're 40. So estrogen's a really important topic because your brain's important, your bone's important, your heart's important, and it's more than just about hot flashes and sex drive. So I believe that women need to replenish their estrogen when their levels are dropping, but in our clinic, we are absolutely focused on safety. And so that means annual testing or semi-annual testing for your liver to make sure that your byproducts of metabolism of estrogen are in safe balance, that you're not a poor methylator and converting it into the negative metabolites. And when we watch that, we're assuring you of your safety. So this is Dr. Natasha Iyer from Better, a medical center for complete living. And you can follow me anytime if you subscribe to www.newrulesforbetterliving.com. And that's where the newsletters come from. Take care and have a great day.